Dr. Patrick Versace talks about cataract surgery and lens implantation. Cataract surgery is one of the most common implant procedures in modern medicine, and it's very successful. In the healthy human eye, normal vision sees light passing through the cornea at the front of the eye, being focused by the natural lens of the eye to form an image on the retina, which is then carried by the optic nerve back to the brain, giving us vision. The crystalline lens, the natural lens of the eye, is an amazing structure as it focuses light, and it can change its shape to change its focusing power, to change the focusing of the eye to give the ability to focus for things up close. The natural lens is supported by the fine zonular fibers that attach it to the wall of the eye. In the healthy eye, the image is clear because light can pass through the clear media of the cornea and the lens to be perfectly focused onto the retina. When a cataract forms, the natural lens of the eye is no longer clear. It begins to become opaque and distorted. So the early symptoms of cataract are loss of clarity with vision and difficulty in getting the correct glasses. As the cataract progresses, the natural lens of the eye becomes more and more opaque until light can no longer pass through it and vision becomes very poor. More advanced cataracts will appear white, with complete blockage of light entering the eye. The only treatment for cataract is to remove the cataractus lens, the natural lens from the eye, and replace it with an artificial lens, the lens implant. This allows clearing of the optical axis so that light can again pass cleanly into the eye. Cataract surgery is performed more than 200,000 times a year in Australia. This is a very successful implant procedure. With surgery, the pupil is dilated to allow clear access to the natural lens of the eye, and the crystalline lens, the natural lens of the eye, will be removed, but we preserve the capsular bag, the fibrous layer that supports the lens. This layer is then used to support the lens implant, placing it into the correct anatomical position in the eye. At surgery, local anesthetic is used. Drops are placed on the eye, and this allows the operation to be performed without pain. This is a painless procedure. The patient will see lights moving and feel some pressure on the eye, but that's the limit of what occurs during surgery. A small incision is made in the edge of the eye. This is small enough to be self-sealing, and rarely are sutures required with cataract surgery. Another small incision is made to allow instruments to be used inside the eye during surgery. And then the eye is filled with a viscoelastic material, a clear, jelly-like material that fills the eye, helping to maintain its shape during surgery and protect the delicate intraocular structures during the operation. This material is removed at the end of surgery. The next step of the operation is to create an opening in the capsule in front of the crystalline lens. An opening is created in this fibrous layer of the envelope that supports the natural lens of the eye. This allows access to the cataract, but also allows us to preserve the fibrous envelope that supports the natural lens of the eye, because it's into this space that the lens implant will be placed. There is now access to the cataract itself, the natural lens of the eye. And using an ultrasound probe, the natural lens, the cataract, is broken into tiny fragments through vibration and then sucked out, aspirated from the eye. This allows removal of the cataract through a very small incision. Once the cataract is removed, the natural lens is removed, We now have a clean layer, the fibrous envelope that surrounded the natural lens of the eye. And it's into this space that the lens implant will be placed at the conclusion of the surgery. We now have the lens implant sitting in the natural space inside the eye and firmly supported in the correct position without requiring stitching or gluing into place. The artificial lens is clear, vision is restored, and the artificial lens can be chosen with different focusing properties. It is very common now to use a form of multifocal or extended depth of focus lens implant that will optimize focusing both for distance vision and for near vision. So many patients after cataract surgery can function for a lot of situations without having to wear glasses, even for reading. It's expected that the lens implant should last forever inside the eye, and apart from a fine laser tuning procedure for a bit of scar tissue, no further interventions should be required after cataract surgery.